Good day everyone, I am Dianne Cristel of BSN 2B, student nurse sa Isabela State University. So in this video, I'll be discussing the problem presence in the family. There are three problems in the family, which is the peptic ulcer, the vision impairment, and lastly, the abdominal pain. First is the peptic ulcer. Health problem is the peptic ulcer. Family nursing problem is inability to make a decision on how to manage due to lack of knowledge and lack of nutrient intake. Goal of care: after nursing intervention, the family will able to recognize and manage the health problem. Objective of care: after nursing intervention, Miss Loretta will able to 1. Monitor condition and take action which will improve health condition. The nursing intervention is first, it is broaden knowledge of the family with peptic ulcers. Second, discuss the effects of peptic ulcers in the family, preventive measures, and proper management. And lastly, and treatments. Discuss the factors causing peptic ulcers. The method of contact is through home visit. Resources: necessary materials is the visual aids, and human resources, which is the time and effort. Evaluation: after nursing intervention, the client identifies the problem and condition and took necessary action when the peptic occurs. Next problem is the abdominal pain. Family nursing problem: failure to manage the problem due to lack of knowledge and food intake. Goal of care, which is after nursing intervention, the family will able to recognize the effect of abdominal pain and manage the health condition. Objective of care is after nursing intervention, the family will first able to monitor the condition or possible effects of the problem, and second, it is to provide necessary treatment to the patient. Intervention: first is discuss the effect of the abdominal pain to the family. Second, explain the possible benefits when the problem are treated. And lastly, discuss the factors that affecting the abdominal pain. Method of contact is through home visit. Resources: maternal resources is visual aids. The human resources also is time and effort. Evaluation: after nursing intervention, the family will have the knowledge on how to take an action when abdominal occurs. Last problem is which is the visual impairment. Health problem is visual or seeing impairment no dabduma nakapsot ti panagkitak as verbalized by the patient. Family nursing problems: inability to make decisions with respect to take appropriate health action due to failure to comprehend the nature of the problem. Goal of care: after nursing intervention, the family will able to take necessary action related to visual impairment. Objective of care: after nursing intervention, the family is first would be able to take appropriate action. Second, able to state the possible effect to the problem, and lastly, able to know the benefit after nursing intervention. Next is the nursing intervention. It broadened the knowledge of the family about visual or seeing impairment. Method of contact is through home visit. Resources: maternal resources is the visual aids. The human resources naman is time and effort of the student nurse and the family. Evaluation: after nursing intervention, the family will able to take necessary action on the said problem. So, dumako naman tayo sa scale for ranking health conditions and problem according to priorities. Problem number 1 is peptic ulcer. Criteria is nature of the problem. Computation: 3 divided by 3 times 1. Action score: 1. Justification: it is a health deficit that can cause complication that needed immediate intervention. Modifiability of the problem is 2 divided by 2 times 2. Actual score: 2. Justification is intervention is available and medicine is available also. Preventive potential, computation 3 divided by 3 times 1. Actual score is 1. Justification, peptic ulcer is preventable through health educating and taking care of our body. Salience of the problem. 1 divided by 2 times 1 sa computation. Sa actual score naman is 0.5. Justification, it is a serious problem that need a treatment. So, bali the total score is 4.5. So, the problem number 2 is visual impairment. Nature of the problem. Computation, 3 divided by 3 times 1. Actual score, 1. Justification, it is a health deficit in the family. Modifiability of the problem. Computation, 2 divided by 2 times 2. So, equal to 2. The actual score. Justification, it is modifiable since we have technologies now and there are surgery in this pertinent problem. Preventive potential, 2 divided by 3 times 1 is equal to 0.66. Justification, vision impairment is preventable since there are right preventable measures. Salience of the problem, 1 divided by 2 times 1 is equal to 0.5. Justification, it is not immediately needed treatment. So, the total score is 4.16. The last problem, which is the abdominal pain. Nature of the problem, 3 divided by 3 times 1 is equal to 1. Justification, it is a health deficit among the family. Modifiability of the problem, 2 divided by 2 times 2 is equal to 2. Justification, medication is available. It is highly modifiable. Preventive potential, 3 divided by 3 times 1 is equal to 1. Abdominal pain is preventable since we have medicines or herbal available out there. Salience, 0. The justification is it is not considered as a serious problem. So the prioritized health problem are as follows. First is the peptic ulcer, which is have a 4.5 actual total score. Visual impairment, which is 4.16 total score. Abdominal pain is 4 the total score. So that we have prioritized the peptic ulcer, which is have highly score of 4.5.